All right, guys, let's talk about iron supplement side effects. Now, if you've taken an iron supplement or you're thinking about doing that, obviously side effects can be a big part of that. They're very common with iron supplements, but more importantly, what I want to cover in the video is there are ways to minimize, decrease those side effects from happening. In my opinion, there's a lot of old, outdated information out there about how to take supplements to minimize those side effects. So we'll spend a good amount of time talking about that. And at the end of the video, I'm going to kind of give you my general recommendation on how to choose the best iron supplement for you. So right off the bat, we have some of our more common side effects. It's very, very prevalent. If you're going to take an iron supplement, it's the big three: stomach pain, nausea, and constipation. Okay, these are very common, but there are ways to minimize them. So let's talk about some of those things. First of all, what's come out in the last few years is normally your doctor will recommend for you to dose your iron supplement every day, but we're finding that people are getting better results and still getting a good response from their iron supplements by dosing it every other day. So not every day, but every 48 hours essentially. So that's something to talk to your doctor about. Stomach pH has been talked about before. What this means is that if you're on anything like an antacid proton pump inhibitor like Prilosec or something like Pepcid, you're taking something to keep stomach acid under control. That's going to increase the pH of your stomach acid. You're going to absorb less of your iron. So that's something we want to avoid, is some of those things. As far as your first pointer about the type of iron supplement, generally speaking, you want to look for a ferrous form of iron rather than a ferric. So, for example, ferrous sulfate, ferrous gluconate, you're going to generally have better results with the ferrous form. Okay. Now, at the end of the day, really it's going to come down to, of those ferrous forms of iron supplements, it's going to come down to how much elemental iron is in it and what's the cost. And that's going to be a very patient, very specific to your situation. Another thing to think about is hepcidin. Okay, hepcidin is basically a hormone that kind of dictates how and how much your body uses iron. And it kind of ties into this next point, which is hepcidin not only does better when you do this every other day dosing that we talked about, okay, but it also does better hepcidin wise if you dose your iron in the morning versus later in the day. So the ideal regimen to keep your stomach side effects down would be every other day in the morning. And we're going to kind of tap into that hepcidin thing. All right. Some people will ask, well, could I take iron with my multivitamin or this product or that product? Avoid multi-ingredient products. If you're going to take an iron supplement, just do an iron supplement, not a multi-ingredient product. People will ask, well, I can take a controlled release. That's what CR is, controlled release, extended release iron product to help keep the side effects down. It will help keep the side effects down, but you're not going to absorb as much. It's not going to be as effective. I do not recommend to people to do any of these extended release products. It's generally recommended when you dose your iron supplement to take it on an empty stomach. That is true. Sometimes people, though, have those stomach side effects. They can't do that. I'll talk about a workaround here in a second. Now, as far as other things to avoid to help absorption of your iron supplement, we want to avoid phytic acid. So that includes any grain products, basically. Phytic acid is in there, even if you're doing a homemade sourdough where it's fermenting. Phytic acid will go down, but there's still going to be some in it. You want to avoid coffee, tea, red wine, beer, chocolate, basically anything enjoyable in life we have to avoid when we're taking our iron supplement, just for the few hours around it. You don't have to avoid it all day, but these contain a substance called tannins. Tannins can also bind to your iron, make it less available. Um, then let's talk about vitamin C, because this one's important. So vitamin C, people, have been told take your iron with vitamin C. That is actually true. You can take vitamin C at roughly 60 milligrams of ascorbic acid to 10 milligrams of elemental iron, not straight up iron salt, but elemental iron. And yes, that does increase the absorption, so that is something to consider. Um, what we're finding is that in most cases, a lot of people are still being prescribed too much iron. Okay, they're taking anywhere from 100 to 200 milligrams of elemental iron a day. That's a ton of iron. Most people don't do well on that. We're finding the research is showing um, maybe 40 to 80 milligrams of elemental iron, again, either daily in some cases or every other day. It depends on the person, it depends on your particular situation. But if you're really struggling, it may just be a fact that you're just trying to take too much iron. Now, I mentioned earlier, what can you do? For example, we talked about ferrous salts being the best ones. Let's say you buy ferrous sulfate. Now, ferrous sulfate is notorious for causing, of course, the stomach side effects, nausea, constipation. What could you potentially do in that situation? Well, what you could potentially do is take it with food, but not any food, because we want to avoid some of these things that are going to bind our iron. But in this case, we could take it with a glass of orange juice. A glass of orange juice, say 240 mils, is going to give you around 100 milligrams of vitamin C. So you're going to increase the absorption of the ferrous sulfate. You're going to hopefully lower that nausea that occurs. So that's a little trick to get around some of the nausea things. Um, and one last point, people will say, okay, well, what is the best iron I could take? It's going to come down again to what the elemental iron that's in it and cost. As far as side effects go, none of them are better than the others. We've had studies that show if you take equal doses, meaning how much elemental iron you're getting from whether it's ferrous sulfate, whether it's ferrous gluconate, whatever it might be, there was no significant changes in the side effect profile of those. Again, it's going to come down to how much iron do you need to get elementally in that particular product, and what can you afford. Generally speaking, ferrous sulfate is a good place to start. Um, the other ferrous salts are fine as well. Again, it's going to come down to cost. I'll include links to a few products in the description. Also, remember, guys, go to the link in the description at my website, curtis-alexander.com. I have a lot more information on natural therapies, ways to get away from drugs and surgery. That's free to you. Just go sign up for that. Make sure to like and subscribe. It helps a lot to push these videos out. So let me know in the comments, was this helpful? Any other questions? I appreciate those things. And speaking of helpful, I hope this video was. See you in the next one. Thank you.